Thank you very much. It's my Elvis impression, best I can do. Thank you very much. Hey, listen, I'm doing okay now. I wasn't doing so okay last night. A trooper pulled me over. He goes, you know, you just went through a stop sign. I go, yeah, but I don't believe everything I read. He goes, you were doing 95 miles an hour. I go, yeah, but I wasn't going to be out that long. And then he said, how come it took me so long to catch up to you? I said, well, 5 years ago, my wife ran away with a trooper. I thought you were bringing her back. Rowan had to listen to these jokes over and without stop, all the way to and from Sierra Leone. So about 7 years, by the way, I want to start out by saying, I kill good bacteria with intravenous ozone therapy, as you're going to learn as I talk. So I had to get involved with finding a real quality probiotic that would work for my patients. And I bought into a company about 7 years ago when I knew this much about probiotics. It took me 7 years to find out I know this much. So it's just amazing what I've learned over the years. So you're going to be getting a little, like not a 101, but more like a 105 course in probiotics today. And you'll glean from what I had to spend 7 years learning to some degree. What you've learned, what you're going to learn. And so I am one of the founders and developers of Doctor's Biome, and I'll mention that again. I feel disclaimers are very important, should be upfront about everything, so I say it at the beginning. And I met him when we used to lecture at Gary Knoll meetings back in the late 80s and I think maybe even the early 90s. And he taught me an awful lot about why I had to have all my mercury amalgam fillings removed. And how he used to do intravenous chelation therapy at the time of the removals, because he taught me that 19,000 times more mercury will be released into your system during the removal than would have been released in your lifetime. He taught me that at lunch one day, and I believe he would be the man who would know. So maybe today with better vacuums and stuff, it isn't as good. But intravenous ozone therapy can remove it off nerve tissue where all the damage is done by the mercury. So that's key and important to remember. So I dedicate this meeting to him because he isn't here anymore, and he ought to have something dedicated to him. This slide, I made this whole up last year for them. And it's now 345,000 direct IV ozone therapies. So otherwise, those other numbers will really hold up. And ozone kills all virus, fungus, yeast, mold, bacteria, parasites, toxins, harmful free radicals, and chelates out toxic metals. That's what it does. So all my patients, I was fixing all digestive diseases and disorders. At the same time, I had to put something good back in. And I learned things weren't working. And you all know this because I'm not going to be reading my slides. If you want me to read slides, you got to get somebody else. That bores the hell out of me. So you can read these. You can get copies of this they're going to send you. So this way you can stay a little bit more focused on the key things. But you got to recognize there is a direct connection between your mouth and your gut. And you will develop digestive diseases and disorders if you have an unhealthy mouth. You all understand that you're not dentists. I know you all think you're dentists, but you're not dentists. You stopped being dentists years ago. You became physicians who specialize in diseases and conditions of the oral cavity, possibly specifically the dentition. In fact, you stopped being dentist at the moment you discovered there were 5 sides to a tooth and you could charge for the filling of each of the sides. It's not just one cavity being filled. So you became real physicians, and that's why these meetings should be directed to you as if for what you really are. All right? So you can read what it says. I tried to use some of the latest slides. There aren't studies. There aren't 1 or 2. There are dozens of studies showing the connection between the mouth, dental caries, and periodontal disease, and the gut, where the mouth can cause gut disease and the gut can cause diseases and conditions in the mouth, which is why you have patients that are resistant when you're treating them with things that should work. Their gut is just too unhealthy to support a healthy mouth. Okay? Let's see, they don't have slideshow on here, but that's okay. Probiotic use provides an effective strategy to combat oral disease. Look at the dates, 2018. If you go back even as early as 2012, that's when a lot of these studies were first coming out. But I'm warning you, and you're going to learn why later on, there's mixed results. So why are you getting mixed results in some of these studies that are being published? And we're going to talk about that. All right? Probiotic bacteria, particularly lactobacilli. The bifidobacterium are beneficial, but the lactobacilli groups are the ones that are most important for the mouth, is what we found out. A couple of the bifidobacteria are important, but and prevention. Listen, I do intravenous ozone therapy for a living. Now maybe 10 to 12,000 treatments a year. I used to be up at 16,000+ a year, but I train doctors and dentists from around the world. A lot of the dentists just learn to use it for themselves and their family. Otherwise, they use it if they wish in their dental practice because there's a direct application. A lot of dentists are afraid to stick needles in a vein because you weren't taught that in school. That's okay. You can get people to come in who can do that for you, phlebotomists and whatnot. They can get trained. But you can send your patients home with less infection and less pain and less inflammation because ozone acts as an anti-inflammatory and a painkiller. And what about your patients who can't use antibiotics for whatever the reasons are, where they have problems with it? So you're already using oral ozone. I call it from the outside in. Now I'm talking about you can use it from the inside out. All right. Another one, probiotics and peri-implants. If you're going to be doing implants, Linda is my dentist. And she just put 2 implants in, and she uses humongous, I make her, and she does it now, I think, without me telling her, humongous amounts of ozonated water and gas, and I don't get infections, and the implants take, and she's just amazingly smooth at it now. All right? But you'll see in the literature, there are contrasting findings from the literature. Many of these papers are reviews of the literature. And they're showing, sometimes it seemed to work, sometimes it didn't work. All right? So, let's see. So, see down at the bottom, reduce the need for antibiotics. So, you're giving antibiotics, and this is a way to help reduce the need for it so you can prepare your patient by having them take proper probiotics prior to this, to your work, and you're going to get, you can't say better results, but you'll get more consistent results with less problems afterwards. And the key is to avoid having problems. And here in this study, they showed in all the different ways you measure, pocket depth, everything else, bleeding on probing, all these things improved with probiotics, all right? Because there is that direct connection between your gut and your mouth. It's more than just that. If you look at the literature today, it's mind-blowing. There's the gut-brain axis. So you can help depression and anxiety problems by having a healthier gut, and vice versa. If you have an unhealthy brain, there's bacteria in your brain that communicate with your gut, and you can have digestive issues. So weight reduction. There's over 15,000 papers written in the last decade on probiotics and its connection to autism, weight reduction, diabetes, breast cancer. I just lectured at Annie Appleseed on the connection between your gut and colorectal cancer, breast cancer, brain cancer. All these connections take place. And you can cause cancer. I think in one of the studies that I have up here, there's a direct connection between an unhealthy mouth and colorectal cancer. So you're preventing it by giving them a healthy mouth again. And if they don't understand it, it's your job to help them understand the human body is not separate parts. It's an integrative organism. And you have to integrate all the parts and make them all healthy. My buddy Rowan, he has this up on YouTube. I still remember this one because I go next month to help him train doctors. I do one-on-ones and he does group trainings, so he needs help. And there was this one woman with back pain for 30 years. And I don't remember which tooth it is. You guys know that better than me. Robert knows this backwards and forwards. He tested a tooth that has a meridian to her low back. He gave her a little local anesthesia in it and her low back pain went away. So she was crying afterwards. She just couldn't believe how fast her pain went away that she's had for 30 years from an injection into a tooth. So you all understand this. There's charts, as you know, that show these connections along the meridian systems. Okay. Specific antibiotics increase microbiotic pathogenicity. Okay. So you can prevent bone loss. Okay, and how do you get, if you have to pull out a tooth and you have to put, you know, a graft in there, you want it to take, and sometimes it doesn't. Maybe it's not taking because you have an unhealthy gut. And it's something, I know it sounds very obtuse, but you have to start thinking out of the box, and maybe you're going to start to see benefits that you've never seen before, okay? And virtually everybody has had an antibiotic even once in their lifetime. Or they eat red meat or chicken that isn't organic or farm-raised fish. I don't care if you burn the meat, you're going to get an uncooked out dose of antibiotics. Okay? So I guess you can also go for kosher or halal, and then hopefully they don't have antibiotics in it. But bottom of it all is people are getting doses of antibiotics all the time, and you wonder why they're allergic to something when you give it to them. I don't use antibiotics in my practice at all, obviously. And I have the most amazing wound care you can ever hope to see. You can't believe some of the things that I've treated. I literally make a goat gag, and we get amazing results in healing with the least expensive wound care in the world. Just using organic ozonated oils and local injections topically, which is the mouth. And then IV ozone, of course, because you got to attack it from the inside out. There's no way you can really fix these things because you can't get deep enough. Okay? And don't be afraid in the mouth. I'm not a dentist. Don't be afraid to inject higher concentrations in the mouth. I know there are some dentists here that may disagree with me. That's perfectly fine. I'm nobody's boss. Say and think whatever you like. But don't be afraid to use large amounts and get it into the bone and get it into the trabecular of the bone and spread it out into larger areas there, because the infection may have already spread into into the bone that way. And I go right into, I see a lot of diabetic gangrene with osteomyelitis. I go right into the bone with this and I kill it. Over and over again, I have nothing is 100%. I have nothing but success. Don't ever promise and guarantee anything to a patient. You never know when you're going to fail, so no moral and ethical doctor should. So L. reuteri, which is a lactobacillus, is very, very important in dentistry. It should be in any probiotic preparation that you're using. It seems to come up in a lot of research papers. They've liked to use that one because it seems to work really well. I know I have a limited amount of time, so I'm trying to get through all this stuff. There's a lot of slides. All right. So in conclusion, it was observed that symbiotic, so you're going to learn what a symbiotic is. It's basically, as you're going to learn in a few minutes, a prebiotic, the food for the probiotics, the bacteria. Okay? And it's spelled S-Y-N. That isn't a misspelling, not S-Y-M. Okay? And again, this was for periodontal disease, and just amazingly important in type 2 diabetics. Okay, so listen, I even printed up one. You can get it if you pick this up over there at the back table. We left some there with the biome to try. You can come by the booth if you want, and we have plenty more. I even picked up one. a paper that I couldn't put into this show, Efficacy of Probiotics Against Dental Caries in Children. Isn't it better to try and have your patients prevent the kids from getting dental getting cavities? Isn't it better to do that than have to sit there with them when the kids aren't particularly happy about going to a dentist and having injections in their mouth or anything else? I don't know. It's a way, to me, the faster I can get rid of a patient or prevent them from needing to see me isn't fast enough for them or me. I mean, we're here to get people well and to help them. And so I look to maximize prevention in every way, but I've been doing this is my 49th year as a doctor, and I don't intend to retire. So if you can answer yes to any of these questions, okay? If you can answer yes to any of these questions, you have digestive disorder. Virtually, if there's anybody out there that's never had an antibiotic once in your lifetime, raise your hand. Okay, occasionally I get a hand that raises when I lecture at big groups. And the reason is they grew up in Africa or in one of the islands and they didn't have money for antibiotics, nor were they available. So it's a rare occasion that no one has ever had it. And then I say, did you ever eat red meat or chicken in this country? Yeah, raise your hand. I haven't eaten red meat or chicken in 42 years. This is my 43rd year. I remember when I became very difficult back from 1980 to 1995, a strict organic vegan. Today, it's easy. There's plant-based everything. So, all right? So, do you have any of these problems? Fungal nails. You can't get rid of fungal nails unless you have a healthy gut, because the problem is candidiasis in the gut. And unless you get a healthy gut and boost your T-cell system, you're never going to get rid of them. You'll get rid of them, they'll come back. You'll get rid of them, and they'll come back. Okay? Trouble losing weight, periodontic disease, trouble controlling your diabetes. That's another big issue. Okay? So that's the whole basis of this. And now we talk about what probiotics are. And there's actual big definitions they use now. Live microorganisms which, when administered in adequate amounts, confer a health benefit on the host. Have you ever taken a probiotic capsule, powder, or tablet and scraped some, or just taken a little of the powder and put it under a microscope? Do it. See if anything is moving. I'm setting you up for what I'm going to be telling you. So obviously nothing is going to move. So what are prebiotics? Prebiotics are basically the food. It's undigestible food components, really, that the bacteria want to eat and love to eat. Now, you can grow bacteria and have them live on sugar. That's not healthy. Okay? They prefer fiber. Okay? And fiber from vegetables is the best fiber for them. They love it the most. Inulin is another one, but it's not that great either. So they're indigestible natural fibers. They're the food bacteria love to eat and grow on and multiply in number. So what is symbiotics? What I said before, they're basically probiotics and prebiotics combined into one. But there's a separate definition called a complementary symbiotic that basically says it will confer a health benefit. So it's obvious then they have definitions and types of probiotics and symbiotics that you can take them, but they won't work. So what good are they? Why? Well, the question is, why won't they work? I'm going to get that answer. So Harvard Health now postbiotics, that's something new. A lot of people don't even know that postbiotics exist. Basically, the best postbiotics are probiotics that have passed away. They've given up their life for you, and now they help your gut create various vitamins and substances that are necessary for your body and your immune system to function correctly. Okay, short-chain fatty acids, okay, that help the bacteria flourish. So if you have the right kind of probiotic where it has prebiotic in it, eventually it also will show up and become a postbiotic to some degree. Okay? the International Scientific Association of Probiotics and Prebiotics, the ISAPP, which I've joined up with, have taught me a lot, because I had no idea what postbiotics do or how they're made. But now we do know what they can do, and they include various metabolites from fermented food products. One of the questions people have is, and I hear all the time, is what about kefir? Kefir is a good product. Yogurt is a good product. It basically has one bacteria species, Acidophilus, in it or so, sometimes two. And they aid digestion, but they don't get rid of anything. They can't stick to the wall, because basically those bacteria are rods. You know, they're like your index finger, if you don't know remember what a rod is. They're just rods, and they don't have the ability to stick to the wall of the gut where you need them. Remember, you're supposed to have over 700 potential species of bacteria. The minimum is 300 or 400 in your gut. And you know, when you're born without any probiotics at all, right? Babies are born without probiotics. They do get some when they exit the birth canal, unless you had a C-section. And then, of course, they get their probiotics from their mother, from mother's milk, if you breastfeed. My mom would never breastfeed me. She thought of me as a friend. Hey, that's Rodney Dangerfield. That's a cute joke. Okay. So, postbiotics, and I gave more slides to it because most people don't know that how important postbiotics can be. And you get the majority of them from bifido and lactobacilli strains, and that's really key. I stay away from the streptococcus strains, like Streptococcus myces, because it overwhelms all the other good boys, and it gives off a lot of flatulence and bloating. So it's not a really great bacteria, probiotic bacteria to take. Fermented foods are excellent to eat. They're wonderful for your digestion. And raw is better. You know, once they cook them so they can give them longer shelf life and things like that, you know, pickles and sauerkraut and whatnot, then you lose some of the real benefit from it. So what are next generation bacteria and smart bacteria? Simply, next generation bacteria are bacteria that have been created. It ain't natural. They've been created to survive the stomach 85 to 90+%, so that the stomach acids and then in the small intestine as well, the bile salts don't destroy them. Regular strains of bacteria aren't created to do that, and you'll know there's a chance they're next generation if they have letters and numbers after their name. If you don't see letters and numbers after their name, they're unlikely, patented strains, and thus unlikely to be next generation. Smart bacteria basically did not go to Harvard or Yale. They were created, that is the actual definition. They change their genetic expression, so when they hit the wall of your gut, they sort of bind with you and become part of you. And these bacteria basically are more yeast-like in structure, okay? Smart bacteria can stick to the wall of your gut where you need them the most, okay? We're doing good on time. You don't get much time, and there's a lot of slides. So what are medical foods? It's another category. Well, there's many different medical foods, but in the probiotic world, a medical food is something that actually shows more than just a health benefit. It actually has been proven to effectively do something, okay? Like Doctor's Biome was tested and published in the Journal of Infectious Diseases, Journal of Gastroenterology Research, showing complete suppression of C. diff in vitro. So now the company is coming out with a medical food version, which just means a more powerful version of it, and then the FDA allows them to say that you can use it to treat C. diff, okay? That may not mean you're going to stop using vancomycin, but you definitely, and I don't know if you ever get C. diff in your practice. It isn't as likely, but if you're using antibiotics, eventually one day you will. 500,000 Americans get it every year. 30,000 Americans, mostly seniors and children, die from uncontrolled diarrhea from it every year in this country. Okay? So it's a serious thing. So these have to be consumed supposedly under the supervision of a physician. Basically, anybody with any serious digestive disease is already under the care of somebody. And if it walks into your practice and something does happen, where maybe a patient of yours did get C. diff, here you have a way of not only preventing it, but a way of helping them get rid of it before they go to their uncle, the attorney. Okay. Medical foods are not those simply recommended by a physician as part of an overall diet. In other words, it has to be something, it's not a diet that you're putting them on, it's something specific that you're giving them to take for that reason. They help process the food we eat, they make vitamins. That's why probiotics, take a look at the list, this is why probiotics are important to your body. But the most important thing is in doing all those things is they communicate with all the organs in your body. I sort of gave you a preamble to that one before. And then I told you about C. diff just now. Fecal transplants are now becoming more and more popular. They've just come out with a pill, filled with feces that you're supposed to take. So the FDA approved it. So Margot Roman, who is a veterinarian, and she has, does ozone in veterinary practice, a good friend up in Springfield, Mass. She has a website because she takes healthy dog feces and makes a slush that you can use as a fecal transplant. And then she also puts it in pill form, and she sells it on a website called Eat SH *T and Live. So they basically have come out with a way to get a fecal transplant, they hope, by swallowing a pill of, I can't make this stuff up. And when the people in the Doctor's Biome company, I told them this is like a delicious oral fecal transplant. They say, you can't say that, it's disgusting, it'll turn people off. But here they come and they did that. So symbiotic medical foods, and now there are a group of them, are basically foods that are given out, usually humongous numbers of bacteria in it, and they're meant for the dietary management of a disease or a condition. So there's problems. When you don't have a healthy gut, it's called dysbiosis. Symbiotics seem to be the best way to help prevent or treat dysbiosis. So why don't all probiotics seem to work? So back in July, I think it was, of 2020, or June of 2020, during the pandemic, they put a show on 60 Minutes, which likes to tear everything we talk about here apart because they're anti-anything that's beneficial and healthy. And they did a show on probiotics, a 20-minute segment. They claimed that millions of people are trying to improve their health by using them, and there's all sorts of information that says they don't work, and they're not wrong. If you read the studies that have come out, there are many, many studies that indicate probiotics didn't do anything for whatever they were using to study it for. So why don't they work? Well, they had Patricia Hibbard, who's from North Carolina University Medical School, and she says, how can you, the whole idea of swallowing these pills and having them wind up in the wall of your gut is just, it's too far-fetched. You can't believe. So they asked her, so why do some people feel better from taking them? And the answer was because of the placebo effect. She said, you expect to feel better, so you feel better. Well, was she wrong? So then they have Elinov and Siegel from Israel's Weizmann Institute, and they've done numerous studies on this, but they did one brilliant one that they talked about on air, and they gave all these volunteers both probiotics that you could get anywhere, but large doses of them, and they gave them placebo as well. And then they had them swallow these pills, right? And then they did endoscopies. So they watched what happened when the pill went into their stomach, and then they followed it up with a colonoscopy. And then they measured what was in the stool. And what they found out was what went in one end came out the other. There was virtually none of them sticking to the wall of the gut because they were using capsules, powders, and tablets. Okay? So why don't they populate the gut? That was the question. It was kind of surprising. And they said most of us are under the assumption that these bacteria would at least temporarily stay in our gut. And they said it doesn't work that way. They don't. But yet, as they say, conventional wisdom says that's not true. People do feel better. People do get better from it. But there's a reason why some people can benefit. Some of them come back to life. Remember, when they make these bacteria, and you'll see on the labels of some of the better ones, 20 billion bacteria, CFUs, colony-forming units, alive at the time of manufacture. They are not saying they're living. They were alive at the time of manufacture. That's true. Then they freeze-dry them, in that ridiculous process there, into a powder that's pressed into a tablet or left as powder or thrown into a capsule. And you're hoping that they're going to come back to life when you hydrate them with water, generally speaking. Many people take it with food. Well, if you let it lay in the stomach long enough, it will be destroyed by the acids as well. So they don't come out of suspended animation. They're basically dead bacteria. And what you can do is take some of these bacteria, okay, take the powder, put it on a slide with water, and look under the slide and see how many of them start wiggling around again. That's a way to tell whether they have the ability to come back to life or not. And they unfortunately don't. Okay? So they came up with another bright idea. Spores. Basically the seeds, if you want to call it that you can plant to grow bacteria from. All right? And the seeds, it was a great idea, but they put them in a capsule. Brilliant. That can survive the stomach. Okay? So that the stomach acids won't break the capsule down in the stomach. Hopefully, it'll open up later on. That's not the case. Unfortunately, what Siegel and Elenov found was that these capsules were either partially opened or completely unopened in the feces. Whether it was spores or not, it didn't really matter. They tested it all. And I don't know about you, but I don't generally look in the bowl to see what's in there, squish it around to see if there's a capsule of something I took that didn't open up. All right? So you're not, plus there's another issue. Time. There isn't enough transit time from the stomach through the small intestine to the large intestine for the spores to come back to life and grow into healthy adults, even if they're the right strains, to populate the wall of the gut. So spores have some small value, just like other probiotics and symbiotics, but capsule, powder, and tablet bacteria just don't work. So what really works? Clearly, you need a complementary symbiotic. They have to be living when you ingest them. They have to be next-generation bacteria. And you need a significant number of strains. That's another issue. Originally, this company had 27 strains. Their actual name is NewGen 27. And when I went to them to tell them I'd like them to make something for me, I told them I'm willing to give them a certain amount of money. I had to keep adding zeros on until they took me seriously. And then they had 3 food scientists. The third one, Dr. Reza Kamari, who I published with, he has a PhD from MIT in food science, and he's a brilliant man. And his specialty is probiotics. So he knew which of these 27 strains they were using would actually work and play well with each other in the colon sandbox, as I call it, and not overwhelm one another. And then what you have them living in became very important, okay? First of all, I don't know what you deal with, but my patients are very ill people. I get patients from all around the world. I get a lot of celebrity patients in, and I have a lot of restrictions, some that I've created. I don't want any sugar. Many of my patients are diabetic. So this has I told them I don't want any sugar or very little sugar in it, and it comes from the mint, kale, lettuce, cucumber, celery, apple, lemon juice, that these 100% organic. That's another issue. I've been living in the natural health world since 1977. It went from natural medicine, holistic medicine, instantaneously it was called complementary medicine, then alternative medicine, then integrative medicine, and now the name of my radio show, Functional Medicine with Dr. Robbins. The same thing I've been doing all these years, just different names. So in any case, my diabetics cannot do any sugar of consequence at all, and this is an extremely low glycemic index and all natural, in a sense, healthy sugar. So it isn't going to cause problems. Alcohol, kombucha, great idea if you can tolerate the taste, which I don't. It's just too vinegary for me. Alcohol, because it's fermentation. That's why they have to refrigerate it to slow it down. Otherwise, it would explode, literally. You take kombucha out and just let it lay in a nice, comfortable room, at room temperature. By the way, you know what room temperature is? Anybody? 77? No, it's whatever temperature the room is room temperature. If it's 0 degrees, it's room temperature. But generally speaking, you think 70, 72, something like that. It will explode eventually, because fermentation takes place. And with fermentation, you get a release of CO2. So, and that's why people get bloating from products like that. So it tastes terrible, there's too much sugar in it and too much alcohol. So kombucha doesn't, and plus too few species, it doesn't work, it wouldn't work for me. You want at least 20 plus billion next generation smart bacteria in there. All right? What they found was if you give them the right food to eat, particularly a 100% organic juice, because the USDA and the FDA allows you to call a 100% organic juice with 95% organic juice in it. This is the US. In Germany, that's not permitted. The juice they use has German certification, because I made a big deal about it. To be called biologique in Germany, 100% or it isn't. That's very important to me. Because you don't know what's in the other 5%. God forbid there's pesticides or herbicides. My patients are very sensitive people, many of them anyway. All right? Smart bacteria. Oh, by the way, when you read the studies, don't get confused. A lot of the different bacteria they study are approved for the study. Okay? You can't get the same exact strain, with the letters, same exact letters and numbers after the name, because the FDA has not approved it for human consumption. So you got to get their brothers and sisters, okay? That's where Dr. Kamari was brilliant in coming up with the right stuff. I'm very difficult about a lot of things because I've been in the natural health world for most of my 49 years and as a doctor. And, things like, if you understand, when you open up a big bottle of something, air gets in. Air is loaded with junk, and it damages whatever is inside, okay? So you want to make sure that 2-ounce shots in a hospital, they're not going to go and pour out things from a big bottle. You give them a 2-ounce shot, throw it away. Amber bottles, so light can't come in and damage it. These are things I've learned from Gary Null and all the other doctors, the big names that I've worked with over the years. And most important, it's got to taste good. Children love it. They started making it in quart bottles. One of the patients told me, I came home, and it's not cheap. They came home, her son had drunk 3/4 of the thing. He thought it was a delicious drink that she just brought home. She didn't know, he had no idea what it was. You can't get hurt, but it's kind of expensive. And once again, I am a creator and partner in this company, okay, as well as their chief medical officer now. You have to drink it living. It's the only way. Now, there's the paper published on C. diff. I have another paper in the handout here because I had we have 80 plus other people with every kind of irritable bowel disease you can imagine. Colitis, ulcerative colitis, duodenitis, ileitis, leaky gut, irritable bowel, Crohn's disease, you name it, we were able to help it. Many of these people in there did ozone therapy. I always tell the truth about everything. They were doing ozone therapy, but many of them weren't. They just did the juice itself. Because probiotics on their own could be all that you need. Since then, that's the paper you're getting a copy of. I didn't think I had it on the slide. Since then, it's been now tested in a woman's health product that they're coming out with, so because it has cranberry in it, but it's the same 15 patented strains, 100% suppression in vitro of E. coli and Candida. I do believe that women will probably use it not just orally, but they can use it as if they get vaginal yeast as a douche, and it may make a big difference, though that's not what the company is going to be saying. And Candida, if you read, this is one of the major things that everybody that walks in front of me has, they don't even know it. If you read the list of the adverse effects that Candida has on the body, all the different symptoms that people suffer from it, it'll blow you away. You can't imagine all the different things unless you read about it. And this is what we treat with ozone therapy all the time. So that weakens your T-cell system, so it makes you more susceptible to COVID and to other viruses. Rowan and I were published in the Journal of Infectious Disease and Epidemiology a full week before the pandemic was declared. The Federal Trade Commission made me take the link from a peer-reviewed medical journal off my website. You can't make this stuff up, all right? There's more to that story. It's kind of funny. So intravenous ozone therapy, I just want to point out, it kills all this stuff. You should be using it in your dental practice. I hope they'll let me come back next year maybe and talk about the importance of ozone therapy intravenously in dentistry, because I train dentists from literally all over the world. Viruses don't go away. You have to kill them. And only one method of ozone therapy, the direct IV method, seems to really be capable of truly destroying viruses, not just improving them, the situation. All right? If you want to be on radio, you can't sell yourself. You have to come on and talk about something important to you in your practice and give out useful, important information. If you're willing to do that, I can have you on as a guest. And the best part is you could say anything you want, because technically I own the show. And I'm heard in over almost 40 countries now. I was heard in the Ukraine during the worst of what was going on there. One week, I don't know what show it was, 32 people from the Ukraine, because I get stats from Voice America, listened to the show. And I'm imagining they're dodging bullets and listening to me on the radio. It's just insane, all right? But you can come on, and it gets archived within 24 hours. So you can link your website, your social media to it. So instead of having to spend time telling everybody about what they're going to ask you a million questions about, tell them, go listen to the radio show. It's impressive. That's one of the things that I do, because I get calls from all over the world every day. Okay? And it shows you how old. Now, the recent number is 38 countries. So when I did this show, it's It was back last year, and it was 31 or 32 countries. Thank you very much.